my name is Andrew Green, ADN student at Wilson State College, and today I'm going to be performing initiating an IV, which includes priming the IV tubing, starting the IV as well. I'm going to be preparing a saline lock, and I'm going to be discontinuing the IV infusion and discontinuing the IV as well today. So first, I'm going to perform hand hygiene and make sure I have an actual order to initiate our IV. So I see that I have patient Shirley Coast, date of birth 4/3 of 1987, and I see I have an order to insert an IV catheter and to start lactated ringers at 150 milliliter per hour via IV. I do see she has an allergy to codeine, so we're going to check that with her wristband. And now that I see that I have an order, I can go into my patient's room and explain the procedure and make sure they understand what will be happening. So I'm going to knock, provide privacy, perform hand hygiene, and greet my patient. So can I get you to confirm your name and date of birth for me? Shirley Coast, date of birth 4/3 of 1987. I see you have an allergy to codeine, which does match our records. So Shirley, today we have an order to start an IV and administer some lactated ringers for you. Now you're admitted to the emergency room for dehydration, so you do have a good reason to have an IV started today. Do you know what an IV is? You do, okay, and you've had one before? Oh, you have, okay. So do you have any questions about an IV? You just want a little reminder? Okay, so we're going to insert a small needle into one of your veins, and that needle will actually come out, and it's just a catheter that stays into your vein, and it's almost like a straw, it bends with you, and that is going to deliver fluids directly into your veins. The procedure is slightly uncomfortable, but once it is completed, usually the pain resides. So do you have any questions for me before I go gather my supplies? You don't, okay. So I make sure the patient's questions are all answered, perform hand hygiene, and go to my med room. So now I'm in my med room, and I see, so I need lactated ringers, so I'm going to grab my lactated ringers and do my first med check. So I have lactated ringers, and again, this is for patient Shirley Coast, date of birth 4/3 of 1987. And I do have her labels here, so I'm going to match those. Shirley Coast, date of birth 4/3 of 1987. So her labels match. I'm going to stick this on the IV bag once I open it. I can see that the solution color is good. There's no cargoes floating around, and the expiration date is not expired yet. So we are good to go for that. And then I have my unopened primary IV tubing. And I'm going to check the expiration date for that, and it is not expired. And the tubing looks in good condition, so then when I do open it, I'm just going to make sure that it is intact. And I have my IV tubing label here as well. So now I'm going to gather the rest of my supplies. So for an IV start, I'm going to need an IV start kit, a saline lock, a saline push, an 18 gauge needle, and that is what I'll need to initiate my IV. So before I leave the med room and I go back to my gym with all of my materials, I'm going to do my second med check. So I have lactated ringers. So we know we're going to be giving her the correct thing, and I will do one more before administration. So I'm going to walk into my client's room, and I'm going to perform hand hygiene. I'll be continuously performing hand hygiene with this skill. So I'm going to greet my patient, and I'm going to ask them to confirm their name and date of birth for me again. Shirley Coast, 4/3 of 1987. Perfect. So I'm also just going to match that with my labels that I have here with all three documents. Shirley Coast, 4/3 of 1987. So all three match, so we know we have the correct patient. So Shirley, since I've been back in, I have all the materials to start your IV. Do you have any additional questions for me? You don't? Okay. So I'm just going to get the IV bag ready and the tubing primed. So first I'm going to open this. And I've done the hand hygiene again. Okay, so now that I have my IV bag open and I've done lactated ringers. Okay, and just squeezing to check for any holes, and there is no holes. So now I'm going to put my label on, and I want to make sure not to cover any of the type of solution it is, any additives or anything like that. So I'm just going to put it on the back and just make sure that matches with my healthcare provider's order one more time, and as well my client's wristband one more time. Shirley Coast, 4/3 of 1987. Okay, so now I'm going to open my primary IV tubing. And again, I would have done hand hygiene, so I can pull this out. And I am going to spike my bag. So first I'm going to pull this cap off, making sure that I stay clean, as that is sterile. As well, I'm going to pull this cap off. So I'm just going to spike. Okay, so now that I have gotten it spiked, I can now hang it onto my IV pole. Okay, before I do anything else, I'm going to want to make sure my cassette is closed so I don't start leaking right away. And I'm just going to pull off all this tape here. Okay. So while I'm at it, I'm going to label this, but after I prime it so I can make sure that all the air bubbles are out. So I'm going to squeeze my drip chamber to about half. Again, my cassette is still closed, so that's about halfway right here. There's usually a line. So this is open, so my cassette is closed though. So what I'm going to do is, this is still sterile. So I'm going to put this in between my fingers. Again, I've done hand hygiene. And I'm just going to pop this cap off. Okay, and I want to make sure I don't touch the end of this, as it is clean. And I also want to keep this cap to put it back on. So I'm going to open my cassette, and then I'm going to put it upside down, as I want to see the square fill. And once it is filled, I'm going to wait for that circle to fill, and I'm just going to leave it open until I see the liquid start to drip out of the top of the IV. And making sure I get all my air bubbles, I'm just going to go a little bit lower to give it some gravity. Okay, so then once I can see the IV fluids come through, I'm going to close this again. And I'm going to return this cap, just so it stays clean. And then I can drape this onto the IV pole. Make sure that it doesn't hit the floor and that this all stays clean. Okay, so now I'm going to perform hand hygiene again. I'm also going to label my IV tubing, now that I have seen that all the air bubbles are out. And I labeled it with the date, the time, and my initials or my name to show who did it and when. So then I perform hand hygiene again, and I'm just going to confirm my patient's name and date of birth one more time. So Shirley Coast, date of birth 4/3 of 1987. So perfect. So now I can start the IV itself. So, before hand hygiene, I'm going to open up my supplies. So I'll open up my IV start kit. So I don't actually need that. So first thing I'm going to do is I'm actually going to look for a good vein. So I'm going to have my tourniquet here. I'm just going to slip it underneath their arm. And tie it. Okay, so I'm just looking for a good vein, Shirley. So can I get you to make some fists, drape your arm off the bed? Perfect. Okay, so once I've located a good vein, which I have, I can undo the tourniquet and give that arm a little bit of a break. So next what I'm going to do is I'm going to get my tape ready. So I'm just going to rip a few pieces of tape and just set them on the table here so that they are ready for me when I put the IV in, as I'm going to only be working with one hand. And we'll just do one more. Okay. So now that I have that, I'm just going to set this off to the side. I have my Tegaderm. I also have my IV site label, so I'm going to just write on it what I need to do, the date, the type of needle, the time, and then my signature. And then that is ready to go once I start the IV. So I have my cleaning solution there, which I don't quite need yet. I'm going to open this again. I performed hand hygiene again. I'm also going to open this. So I'm going to prepare my saline lock. We'll just let that down. So again, I performed hand hygiene. And I'm conversing with my patient while I do this, making sure they still understand the procedure that we're going to be doing. So first, I'm going to take off the cap of this, remove any air bubble that might be in there. Okay, so the air bubble is gone. And I'm just going to lift this up and I'm going to place it into here. Okay, so now that's on, so I'm going to take this cap off, as I only have one hand to work with once I insert the IV. So now that cap is off, I'm just going to prime my tubing. So I'll wait till I see that drop. Perfect. So it is now primed, and I'm going to set it back into this container because it is clean and sterile, which that tip is as well. So now that I am ready to insert, I have my tape ready, I have my saline lock. I'm going to open up my needle so that it is ready. And sorry, I did forget to mention that I place a chuck underneath my patient's arm before I insert the IV, just to help prevent any messes or spills. So I performed hand hygiene, and I have my needle ready, my saline lock, and my tape. So I'm going to don my gloves after performing hand hygiene. Okay, so now that my gloves are on, I am going to open this, my cleaning solution. Okay, so then I found that vein that I liked before, so I'm going to engage this. And I'm going to clean for about 15 to 30 seconds, about the site that I'm going to be inserting it. So after cleaning for 15 to 30 seconds, I'm going to let it dry. And as it dries, I'm going to retie the tourniquet. So I'd make sure that this is dry, because if it is not dry, it would sting if I were to insert the needle. So now I'm ready for insertion. So I'm going to uncap, explain to my patient that I'm going to be inserting. And when I'm going to be inserting, what I'm all going to be doing, I want the bevel up and at a 10 to 15 degree angle. So Shirley, I'm going to start inserting the IV, okay? Take a deep breath, it's going to pinch. So bevel up, I'm going to insert. Okay, and I see some flashbacks, so I'm going to go 1/4 of an inch further, but because of these arms, I'm actually going to push all the way, as we can't float them in very well. Okay, so then I'm going to engage my safety. So now that it's engaged, I'm going to undo my tourniquet. So I did see the flashback, so we know we're in the vein. I'm going to occlude the vein, as well as support the catheter as I untwist this. So I'm going to let that go and quickly put on my saline lock. So now that that is on, I'm just going to support the catheter here, and I'm going to flush the IV to make sure it is patent. So I've already primed it, so I'm just flushing. And I don't see any raised spots, any coolness, so we know that the vein is, or the IV is patent. So now that that is, we know that that's patent, I'm going to tape it before I remove the syringe. So I just want to tape it on the catheter part to make sure if they ever need to change the saline lock that they could do so. So tape that down, and then I can remove the syringe. So as well, we can tape this up with it. Okay, so now that's taped, I'm going to put on my Tegaderm. Again, just over the catheter itself. And unfortunately on these arms, it doesn't stick all that well. But on a real person, this would stick quite well and secure the catheter. So now that that is secured, I've already labeled my IV start. I'm going to also put that on them. And just put it on like the tape. And I'm going to put this into the sharps and clean up my workstation. So now I need to start the IV fluids. So I have this. So what I'm going to do is I'm going to clean the saline lock, as I've already had a syringe on it and now it's been touching the skin. So we're just going to clean it for 15 to 30 seconds. And then once that is dry, we can put on the tubing. So both have already been primed. So then I can open my cassette and the IV fluid will flow through. So I'm also going to, I can perform hand hygiene again. And now that the IV solution has started, for an extra measure, just to make sure that this goes everywhere with the patient, we're just going to tape it to the arm. Okay, so now that I finished, I make sure my patient is comfortable, ask how they tolerated it, and I'm going to go back and document my findings. So the time I started it, the site I started it at, the size of needle, the gauge, as well as I want to know how the patient tolerated it, the IV fluids and the amount that I've started, which is 150 milliliters per hour. And after I've documented all that, I'm going to go back to my bedroom. And now I see I have a new order to discontinue the IV fluids and saline flush it. So, what I'm going to do is I'm going to perform hand hygiene. I'm going to go back to my patient and I see I have the orders. So I've done for Shirley Coast, April 4/3 of 1987. I'm in her room now. I performed hand hygiene. I'm going to get her to confirm her name and date of birth. Shirley Coast, 4/3 of 1987. Perfect. Okay, Shirley, so we have an order to discontinue your IV fluids. So all I'm going to do is turn off the fluids that are going into your vein and just take off the tubing. So, sorry, I would have also removed the tourniquet. Just out of the way. So I'm going to don some gloves after I've done hand hygiene. Okay, and I am going to take off the tape for the IV tubing itself. Okay, and I'm going to open my saline flush that I have with me. And then what I'm going to do is I'm just going to close this cassette and the IV fluids will stop. So I'm going to untwist this up. This. I'm just going to put it here because I'm now done with it. And I'm going to clean this port. So after 15 to 30 seconds of cleaning and it is dry, I will now put on my saline push, and I'm going to make sure there's no air bubble. Make sure there isn't. Okay, so now I'm going to push to make sure that all the medication has been administered and is through the saline lock. So I'm going to push. And once that is all administered, I'm going to lock the saline lock. And I can remove this. So I've asked them if they had any questions, any concerns, and then leave the room and document that I've stopped the IV infusion. And now I see that I have a new order to discontinue the saline lock and discharge to home. So I'm going to be removing the IV as a whole. So I'm going to, I have patient Shirley Coates, date of birth 4/3 of 1987. I'm going to go into a room and confirm name and date of birth. Shirley Coates, 4/3 of 1987. Perfect. Okay, Shirley, so now we have a new order. You're being discharged to go home, so we're going to discontinue that IV for you, okay? So first, I would get your gloves and do hand hygiene. Just going to get some tape. Ready? Okay, Shirley, so I'm going to start removing the tape. So I've already flushed the saline lock. So it can all just come out as one. So I'm going to remove the tape, support the catheter. And I'm going to bring my gauze here. Okay, Shirley, so I'm going to remove the catheter. Ready? Okay, so I'm going to pull it out. And apply pressure. Okay, so and then while I'm applying pressure, I'm looking to make sure the tack is intact, which it is. And then that can go into my sharps container because it is intact. And then when I apply pressure, I'm just going to put some tape. And then if they would like to apply more pressure, they are more than welcome to, but they are now ready to be discharged home. So I would go back, make sure they don't have any questions, make sure they tolerated the procedure well, perform hand hygiene, and then I go back and document the time I stopped the fluids, the time I stopped the, or discontinued the IV, as well as pushed saline for the saline lock and flushed it, as well as the site I stopped it from, the gauge and the needle, and that the tip was intact, and that is a very important aspect, as we don't want a tip left into their vein. And after that, the client is ready for discharge.